In Uganda, the rate of malnutrition is very high. Chronic malnutrition and micronutrient deficiencies, especially of vitamin A and iron, is a big problem. In Chivoga district, which falls under the central region of Uganda, Uganda Demographic Household Survey 2011 findings indicates that 36.1% of children under 5 were stunted and 11.4% were underweight. The WHO standards classifies Uganda's nutrition situation as serious for stunting and poor for both underweight and wasting. Malnutrition directly and indirectly contributes to up to 60% of child mortality, making malnutrition one of the most significant contributors to child mortality in the country. The country spends over $254 million per year treating cases of diarrhea, anemia, and respiratory infections linked to malnutrition, according to Cost of Hunger Report 2013.
Abaana betusinga okufuna wano moodi y'abaana musujja abaana abalwadde omusujja ebiddukano kusesema bifuba n'obulwadde bw'endiisa.
Survey reports indicated that much as the communities were ignorant about the proper child feeding practices, health workers also had capacity gaps. The health workers lacked knowledge and skills of tackling malnutrition in their catchment areas. It was therefore prudent to build the capacity of health workers and equip them with relevant tools. And at the same time, communities had to be trained, and the training involved demonstrations on preparation for the child-tailored meals locally known as echitobero.
Before our division came in, the district had a challenge of not having proper knowledge of the health workers to prevent, to treat, and even to rehabilitate children who are having malnutrition.
Assessment data collected in 2009 from Kimu and Intwetwe ADPs showed that maternal, child health and nutrition was a gap that needed to be addressed in the communities.
Abaana bali mu mbeera nga mbi naddala mu byobulamu by'abaana abo. Naye twagenda okizuula nga butuufu yalinda birira mbi ne batusomesa ekyoto ku kiseera kye batugamba kyoto PD HEARTH. Ne tusoma bulungi nnyo ne batubuulira endiisa z'abaana n'engeri gy'ozuula omwana nga mulwadde weewaawo nga tunaamutwala mu ddwaliro.
Eno y'emmere gye tufumbira abaana baffe ebazzaamu ku maanyi, muwogo, amatooke, obukupa. Zino zenva ze tufumbira abaana baffe, mukene, byennyanja, n'ebinyeebwa, n'ebijanjaalo. Lino eppapaali lyeri tuyambako ku bulwadde obuba buzinze mu baana, mpozi ne ovakado n'obutunda okukamulira ku baana okubazzaamu ku maanyi. Zino zenva ze balya ezibazzaamu ku musaayi, ne doodo waffe, doodo, sunsa, byonna tubibawa.
Nga nze bwe nali sinnayiga ebyengeri gye babifumba nafuna okusoomoozebwa kuno. Ebintu byalingawo ewaka naye nga omwana omuwa talya ate nga simanyi ngeri ki gye nnyinza obikwata, byonna n'abifuna omulundi ogumu n'abirya ate ne biba nga bikoze ekintu kye.
PD HEARTH sessions were concluded in 22 villages of Ntwetwe ADP, which were identified to be most hit by malnutrition. Of the 163 children identified as malnourished, 87.5% regained their normal weight. The PD HEARTH involved participation of mothers and caregivers on the 12-day session that involved participants learning skills of food preparation, feeding, hygiene, sanitation, and caring practices.
PD HEARTH is a community-based model which uses the local knowledge about child feeding. It builds on already what the community knows about child feeding, and also uses local resources. So in that way, the communities appreciate what is being done in PD HEARTH very fast. They learn, copy, and then replicate this knowledge in their homes. Currently, malnutrition, specifically underweight, stands at 14.6. We have managed to reduce it from 19.6 to 14.6.
We used to have many cases of malnutrition, like 8 cases in a month. But after the intervention, now we receive like 1 or 2 cases in a month, and sometimes we don't receive any case of malnutrition at the facility.
In its efforts, World Vision, together with its development partners, formed the UCOSAN, Uganda Civil Society Coalition on Scaling Up Nutrition, to lobby and advocate for improved legislation to prioritize maternal, infant, and young children nutrition.
In an effort to contribute to the scaling up of nutrition in Uganda, civil society organizations formed a coalition, the Uganda Civil Society Coalition on Scaling Up Nutrition, which basically influences nutrition policies and nutrition programming, and seeing to it that what is decided upon at the national level is implemented at government level. The coalition is chaired by the Uganda Action for Nutrition, and it has 30 registered organizations, including World Vision, Save the Children, and a number of other agencies.
We partner with World Vision in specific Chiboga cluster. And one of the key areas of our partnership is nutrition.
Now the community is at least aware, I can say to a rate of 70% that it is aware of how to address such problems of malnutrition through proper feeding, and this has come as the result of the PD HEARTH model.
Our strategy is to work with government. Right now we are supporting the rollout of the Uganda Nutrition Action Plan, and we work specifically with the local governments to strengthen their capacity. So we've seen Positive Deviance have work in a number of districts, and we had very high success rates of almost, in Chiboga it was about 78%, and then in Soroti we had success rates of like 85%. We also have a lot of synergy with WASH, because a lot of malnutrition in Uganda is caused due to infection, due to diarrheal diseases. So we promote a lot of hygiene and sanitation. Hand washing is one very simple practice, but which is not widely known. And so we support mothers to be able to have like tippy taps at their toilets, to be able to wash their hands at 5 critical points using soap, or ash where they don't have soap. But we also support infant and young child feeding practices. Early initiation, children to be initiated to their breast within 1 hour of delivery, but also exclusive breastfeeding for the first 6 months, and then complementary feeding while continuing to breastfeed the child until the child is 24 months. So these are the approaches we've undertaken in addition to the direct nutritional support of children.